If you have an injury to your hand or to your wrist and it's not working as well as you would hope, then it's quite natural to think, I must get this fixed and I will be back to how I was before this injury took place. A lot of injuries around the fingers and the wrist are better managed without an operation. And the best person to judge that is either a hand surgeon or a hand therapist who will have seen all the different ways that these things can be treated. For example, a broken bone in the finger, if it's not very displaced, may do much better from splinting and then hand therapy rather than an operation. When we expose some of the soft tissues of the finger to the air, such as tendons, they become sticky and tight, and then they don't want to glide. So between you and your surgeon, you will come to a shared decision about what's likely to have the best outcome for your particular injury. Sometimes injuries around the joints do need restoring to anatomic position, not just for today's function, but to try and improve tomorrow's function. We often have this difficult discussion about ligamentous injuries in the wrist. If currently patients are not particularly troubled, but the evidence tells us that in the future the situation may gradually sink out of shape and we may be in greater difficulties. So the decision on whether or not something should be fixed or something should be rehabilitated, or even fixed then rehabilitated, is a very difficult one and is one that you do need to share with your surgeon. It may be quite a surprise to find out how many things will improve by themselves, and it may also be a disappointment that the end range of movement may not be exactly the same as it was before the injury. But the goal of treatment is always to get the best possible pain-free function that we can have with the injury that we're faced with.